First thing that we'll do is log into Clinical Care Station from the icon located on the desktop. Double-click the icon and put in your login and password. Make sure you are in the correct environment. Paragon Test is where you'll be charting most of your information. Click OK. This will open up the Clinical Care Station splash screen. Next, we'll click Care Glance. This is our Care Glance screen that has a list of the patients located on the floor that we are defaulted for. I'm going to change our floor to 4 East, where our student patients are located. At the top of the screen, you'll see it's titled Paragon Clinician Care Station with a current user, myself, and the environment Paragon Test. The environment is very important so that you're documenting in the correct environment, whether it's tests or live. Next, we have our Windows menu with File, View, List, Window, and Help. Below that is our primary toolbar. This has many icons that are used to access different applications and different functions throughout Paragon. The first one, it looks like an open door with an arrow. It is our exit icon. This is the way that you will always exit out of Paragon. Below that is our secondary toolbar. This toolbar has options associated with the screen that you're currently on. There's a printer icon, a legend icon, sticky notes, and numerous other things, including our yellow arrow, which is how we save and close our current pages. Within our Care Glance screen, we have different search options if we're looking for a particular patient, or we can go to our floor that we are defaulted to or choose any other number of floors. I've chosen 4 East for our Orient patients. That's where they're located. You can also search by name, visit ID, or patient type to help sort that down. You also have different options that you can check mark next to the patient name, such as assign patients if you've assigned patients to yourself, include unknown room or bed if the patient is not located within one of our current floors. Mask patient name is an option that if you are going to walk away from your computer screen or feel like someone's watching your screen, you can just show their name abbreviations. You can also exclude discharged patients, which are none listed here, but that way they will fall off. On the far right of the screen, we have our retrieve arrow. Anytime a change is made within our search criteria, we must hit this retrieve arrow to refresh our screen. Let's first look at the legend icon on our secondary toolbar. It looks like the legend on a map. When you click it, it opens up a screen that shows us what all these colors and bubbles mean. On our admission assessment, for example, red means there's not been one started, yellow means it's in process, and green means it is complete. On medications, green means the visit has scheduled medications, yellow means medications are due, red means medications are overdue, and white means the visit has no medications listed. This is a good reference for any time you have questions as far as what the bubbles mean, or what their abbreviations stand for, or what the different colors associated with those bubbles stand for. We also have an icon for sticky notes at the top. If you'll select a patient by highlighting it, you can click sticky note and add a certain note to the patient. This note is not part of the permanent record, but will be associated with this patient until you delete it off. Once you click OK, that sticky note symbol comes on the left side of the screen and can be accessed by double-clicking it. Again, this is not part of the permanent record, but the only person that can delete this note is the person who created the note. Also, if your patient is highlighted, you can add alerts to that patient. We'll click the icon. It looks like a blue siren. It says Patient Alerts. And you can choose from any number of alerts from the drop-down. For example, if the patient is an elopement risk, click OK. Once we hit retrieve, we now have a red alert also on the left side of our screen. This too can be accessed by double-clicking again. It can be deleted, or a new one can be added by clicking the white sheet of paper. If you're taking care of multiple patients on the same floor, you can assign those patients to you. If you click the Assign checkbox, you'll get a pop-up window that asks for you to select your shift. I'm going to be on day shift. It also gives you the option to assign selected shift to all selected patient visits so that you don't have to do this every time you select the Assign checkbox. Once I have my patients assigned, I can choose the Assign Patients checkbox, click Retrieve, and now I only see those patients assigned to me. This helps to clean up your screen. Now let's look at a couple different ways that you can chart. Once you have your patients selected, the next charting we're going to look at is called Flow Sheet. It looks like two thermometers crossed over each other. Select the Flow Sheet icon, and you'll be able to see vital signs, pain score, and eyes and nose from the screen, as well as different measurements. These will be collapsed. You can click the All plus sign or individual plus signs associated with each value. I'm going to click All, and it expands the screen to see all these values. At the top is our patient-specific information so that you know you're on the correct patient. To add a new vital sign, for example, you can right-click, select New, and then Vital Sign Entry. Here are your most common vital sign entries that have been saved. We'll enter in some temperature and other vital signs. Once you've entered your vital signs, you can either click OK or click Insert New if you have multiple vital signs to enter. We're going to click OK. You can see your most recent vital signs that have a yellow background, meaning they have not been saved. So if you notice that you made an error, you can click on that particular vital sign and edit it. Click OK again. To save this information, yellow arrow out, which works as close and save. Let's go back into Flow Sheets. Right click for New, and instead of vital sign entry, let's choose I&O. Again, here are the most common options for I&O entry. We'll put some values in. When checking the count column, it means one time. This is also appropriate when charting an incontinent patient. You have the option on the right side to add a particular I&O if the most common results on the I&O screen do not fit what you are trying to chart. You can search or click Retrieve to get a complete list of the different types of eyes, nose sources. To add them, you would select it and choose Select. This then adds that source to our INO screen. Once we're finished charting I's and O's, again we click OK, and we can review them under our INO section. Again, they're highlighted in yellow because they have not been completely saved, and we can edit them if we need to. To save, we're going to yellow arrow back, and now we're back at our CareGlance screen again. We'll click into our flow sheets icon one more time. We're going to right click for new, and this time we're going to chart measurements. Here is where you can chart the different food intake for breakfast, lunch, supper, snack. Blood glucose can be charted here, although it's not recommended because they flow over as a lab result. So we'll chart 75% lunch intake. Select OK. All this information can be reviewed by clicking the All plus symbol and scrolling down the page. We'll yellow arrow out to save our most recent information, and we're back to our CareGlance screen. Now we'll look at our daily focus assessment charting. The first thing we need to do is make sure we're in the correct unit type. The two folders with arrows at the top icon is called Change Unit Type. By clicking it, we have the option to choose the correct unit type that we'll be charting. Most will either be Med-Surg or Critical Intermediate Care. I'm going to select Med-Surg. Click OK, and we're going to click the Perform Assessment icon. Once we click the Perform Assessment icon, we go to the Daily Assessment. We'll get a pop-up that asks you if you would like to backdate your assessment. If you performed your assessment at a previous time, you could change that time here. I'm going to leave it for our current time. Click OK. Once the assessment opens, we have many different tabs across the top of the page for different charting. The first tab is for ADLs. We'll choose the patient is resting in bed with eyes closed. Next, we have our VTE tab that gives you different options for charting VTE prophylaxis and treatment. The Cardiology tab is next. This is where you chart things like your heart rhythm, pulses, and heart sounds. To chart a different rhythm, you can click the checkbox. Same for heart sounds. Some checkboxes have what are called secondary finding codes. Pulses, for example, when you click the checkbox, opens a new box which asks for the description of the pulse. You click the description and click OK. Same thing for edema. These type of pop-up boxes associated with charting are seen throughout the daily focused assessment charting. Next, we have the Neuro tab. You can chart what is appropriate here. The Glasgow Coma Scale is a little bit different in that you just click on the value that you want associated for the patient, and your total score is added up for you. All other checkboxes are similar use to the previous tabs. The Neuro 2 tab is more specific to a thorough neural examination. The Respiratory tab is next. You'll notice secondary finding codes associated with the lung sounds. If we choose diminished, we then must choose the lobes that we hear those in. And the same for other sounds. You will notice as you are charting that check marks will appear across each tab that you have previously clicked on. Next, we have our ENT tab and our GI tab. GU, and multiple other tabs that may be specific to your patient. Each individual box on the tab is called a group. By right-clicking on the top of the group, you can add a group note. Here is where you can add information that is not available to be charted within the group. And then click OK. Once you click OK, you can see the little yellow note next to the group heading. You can also add a note associated to the tab. By right-clicking in the gray area, you can add what's called a category note. Here you can type information associated with that particular category or tab. Again, once OK is clicked, you see a yellow note next to the category heading. Next, we'll look at our pain tab. You have different options to choose if it's the initial assessment, reassessment, or if the patient denies pain or has no pain. If the patient is on a PCA pump or other infusion, you can fill that information out here. The PA scale is important to fill out for each time the pain is assessed and is a requirement. To open the pain assessment, click the button that says Pain Assessment. Here you can see previous charted pain. I'm going to click New, and you can see the different descriptions on charting pain. By clicking into the field, it gives you some of the most common reported pain areas. You must choose a pain scale and a pain score. Other descriptors of the pain are available, but may not always be necessary. Once finished charting your pain information, click OK. That newest pain score is shown on the screen. When finished here, click Close. There are many other tabs in the Daily Focus Assessment that may be pertinent to your patient. Some of these include skin, IV, wounds, psychological tab, miscellaneous, and safe patient handling, just to name a few. Review each tab on your assessment. This is all we'll chart for demonstration purposes. Now that I'm finished, I'm going to click the yellow arrow to close and save our document. It will ask you, do you wish to close this assessment? Click Yes. And now we're back at our CareGlance screen. Next, we'll go to our Encounter Management icon on the primary toolbar. Within Encounter Management is where you would strike and amend or close selected encounters. We have our dates selected here. With our patient we have selected and been charting on. It has my name here. I'm going to select Get Encounters. It pulls up all charting and documentation that I have performed. If I had made a mistake, I can strike and amend the selected encounter. Or if I had left an assessment open, I could close a selected encounter. Let's strike and amend a vital sign encounter. I'll highlight the correct vital sign encounter and choose Strike Amend Selected Encounter. If I wanted to change the heart rate, I would click the heart rate, and I get a warning message that the data I've selected will be struck. And would I also like to amend it? If you would like to amend it, you can click Yes. If you would just like for it to be struck, click No. I'll choose Yes. I can type in a reason or choose a pre-selected reason of data entry error. and click OK. Now I can type in my new value, which will become blue. Once I've changed that value and any other values that I wanted to change, I can yellow arrow out and save my changes, and I'm taken back into the encounter management screen. The daily focus assessment works the same way. I'll choose my daily focus assessment and choose strike amend selected encounter. I can see all previous tabs that I have charted on. If I wanted to chart or change the rhythm that I charted, I can unselect normal sinus rhythm. I will have to click the blue note and choose data entry error. Click OK. That value will become red, meaning that it has been struck, and choose my new value, which will also force me to choose a data entry error. Click OK. The new value is checked and becomes blue. Once you've made all necessary changes, you can yellow arrow out to save that assessment. If you were to have an open encounter, you can highlight that encounter and choose Close Selected Encounter. An open encounter is created by choosing not to close that encounter when you're exiting out. This would only be used if you needed to return to chart information on that same encounter. We encourage you to chart all your encounter at one time so that you do not leave any remaining open encounters. Once you have your encounter that's open selected, you can choose Close Selected Encounter. This will allow you to chart any remaining information, and then you can yellow arrow out. Again, it will ask, do you wish to close this assessment? And click yes. Let's yellow arrow back to our CareGlint screen. With our patient highlighted, we'll choose our next icon, which is our order management icon. By opening order management, it will actually launch you into a different application. This is where all written orders are entered and where you can see all current orders for the patient. Once in order management, we can click on our Order Inquiry tab and see all the current orders for the patient. You can sort by order number, description, start date, and stop time by clicking on these column headings. To view a lab, highlight the lab and select Results. There you can see the time it was collected and the result. When you're finished, yellow arrow back. You can always see more detail about a particular order by double-clicking that order. This Nursing Miscellaneous, for example, has instructions behind that Nursing Miscellaneous order title. You can click Close and go back to your main order inquiry screen. Once you're finished in order management, you can yellow arrow. Once there are no more yellow arrows, you can hit your exit door, which will end your Paragon order management session. And now we're back to our clinical care station screen. Once I have my patient selected, I can launch patient profile. This launches patient profile into a web-based window, which is very similar to what the physicians see when they're doing their documentation. Across the top, you can see that our patient that we had selected is chosen, and we're under the Profile tab. You have options to expand each section or collapse each section. When first starting here, it's easier to collapse all sections so that you can better get a footing of what this looks like. You can see as we scroll down, each section has a drop down that you can open, see more information. There's also an index located at the top of the page that if you click, you can customize what order, or if you click on each individual section, it will take you to that section. I clicked Family History, and now Family History is at the top of my screen. I'm going to close this index. There's also a button titled Legend. When you click this button, it will tell you what certain things mean and how certain text means different things. When opening a section, you choose the drop-down arrow, and you can see the previously charted data there. Now we'll look at the section about patient education, where you can see how to look up patient education information. If you click on a patient, choose the patient profile icon. Once profile loads, you have a section on the left side of the screen that collapses automatically, which is normally a good thing so that you can see everything easier. To expand this section, you can click the little down arrow and then change this drop down to patient education. Here, if there had been education provided to the patient previously, it would be listed out. To add education, if you were adding education to the patient's discharge as far as medication or diagnosis, or if you were educating them on something while they were in the hospital, such as smoking cessation, you can click Manage. This also would list out their education that they've been provided here. And then you can click Add if you needed to add it manually, or Get Education will pull up a list of all the patient's current medications and problems that you could choose from. This test patient doesn't have any problems that we could choose from, but they would have listed out pneumonia, congestive heart failure, whatever the patient had going on. I'm just going to click furosemide and then click Retrieve. This then launches into Micromedex, where it will pull up the selected education topic. If you needed to add it manually, you can click Add and just type in what you educated the patients on. I'm going to put a date and time. And then save. Once I close this, that education will pull over here. When you click Get Education and Retrieve to pull up that information or pull up the education for the patient, that also, once it's printed, will be blown back into this list automatically. This is typically done by the charge nurse. Once finished here, you can either leave this drop down open or you can collapse it back up so that you have the full screen to view your patient profile. That is your patient education section. After you've chosen your patient education drop down here, every time you open it, it should stay on that patient education area. Another important part about reviewing a patient's information, especially for pre-planning or while you're taking care of that patient throughout the day, is being able to see results of imaging and lab studies. One of the easiest ways to do it, and the way that the nurses commonly use, is by using this NR, or New Results column. If you double click on the bubble associated with your patient, a new list pops up. This list is going to include all orders for the patient, and you can see what the orders are, who ordered them, the time, and everything important with that order. This patient hasn't had any lab results in a few days, so if you scroll down, you start seeing symbols that represent the lab results, whether they were OK with a green check mark, whether they are high or out of range with a hazard sign, or if they were critical, it would have a red C symbol there. But to see those lab results, you just double click on the ER troponin, for example, and a report pulls up with that result. Another example, we can look at this ER CBC, and again, there's the result with your highs and lows marked out beside of it that looks just like a printed lab. Imaging the same way. This CT angio with chest, if I double click on the camera and then double click on the title of the report, it'll pull up a section that looks like a report, or what should be. This one is blank because it's in our test environment, and I guess nothing printed or is being very slow. And that's how you would see those reports there. So any lab that's been ordered and resulted can be viewed here just by double clicking on them. This also is going to have a list of what should be your current meds, although the best way to see what meds are due for your patient is to go through MedAdmin. The other way to view results, whether it be imaging or lab, is to actually launch into the new patient profile. This will bring up the window that we're already familiar with, but now we can click on flow sheets. And the flow sheets tab is where most of the physicians and or providers will go to review results there. When you open this up for the first time, you should be defaulted into the results tab. Here, this is going to include all your laboratory results, and if you continue to scroll, at the bottom of this list, it will also have your imaging results. So if we keep going down, this patient may or may not have any. There's some. So there's our CT, ultrasound, X-ray. Now you may not be able to see the results on this screen. You can see it's a spreadsheet format, but at the top we have our dates. And if we click here, we can scroll back to see what tests were done and when. You may have to go for a little ways, especially if this is our test environment. You shouldn't have to go this far. You can also click on the white sheet of paper next to each test, and it will tell you when that test was done. So this, because it's our test environment, there hasn't been anything done since October 22nd. So I can choose the date of October 22nd. And now I can see our results. Obviously, a patient that's currently in the hospital, your results would be much more recent and you wouldn't have to go back that far. But you still may want to scroll back and forth to trend those results. So now if I scroll down, I can see my CBC, CMP, coags, all that information there. Where's our cultures? And then here's our imaging results. To see the report for those images, you can click on the sheet of paper. It'll come up with a report that you can review. If you wanted to see the image, you can actually click on what's supposed to be a rib cage there, and it will actually show you the image. The same way for the cultures. If you click on them, the report will populate and tell you what is being reported there. Even on our CBC here, for example, you can see the results, but if you wanted to click on it, you can click on any one of the analytes and it will pull up just a report like it did in the new results column. Another option that you can use is reviewing results is to create or add custom flow sheets. You can see across the top we're on a results flow sheet. There's an I&O flow sheets that if you click on, it just would report the patient's intake and output. The MAR is going to be a list of the patient's current medications and when they are due. Nursing is going to be all the charted nursing data. That also includes case management, PT, OT, and all of those. If you click on more flow sheets and then manage favorites, you can actually add custom flow sheets that we've created for the physicians and other users. The most popular being lab and imaging. That way it makes it easier to find those specific things without having to go through the results flow sheet, which can be very large. Cultures is also one that you can add. This is the same information that's all on the results flow sheet, but it makes it a lot easier to find and test. And there's multiple other ones that you can choose. These are all I'm going to add, so I'm going to click confirm. And as soon as I do, it's updated my list, and it also updated the order that these appear. So now if I click on my imaging, I don't have to scroll all the way to the bottom. I can see all my imaging results for that patient there. Cultures the same way. I don't have to scroll down or change dates. You can see that the date is when those were actually performed, so it saves a lot of scrolling. So you have two different options. It's patient profile to flow sheets to be able to see results, or you can always just use the new results column that's located on the Care Glance screen. Either way, you should be able to get the results that you need. To see previous charting on a patient, we'll highlight the patient and select our inquiry icon. From assessment type, we'll choose daily for a daily focused assessment, or you could choose admission or any number of things depending on what information you're looking for. We'll choose daily. You can also select a particular time and date range, as from admission date is defaulted. Then click your green retrieve arrow. Here, previous charting is seen in a spreadsheet format. You can scroll to see the different data entry. There are a couple ways to see vital signs that have been charted. You can scroll down and choose vital signs, then click retrieve, or you can choose inquiry flow sheets, which will have the same information with a graph as well. Now we'll yellow arrow back to get back to our inquiry screen. The admission assessment is where you can see information collected from the patient on admission. Once finished, you can yellow arrow back.